All right, good morning. It's good to see you. As always, thank you so much for joining us on My Doctor. My name is Winnie Lubembe. Of course, today we want to focus on contraceptives. And, contraceptive use has increased in many parts of the world, especially in Asia and Latin America, but continues to be low in sub-Saharan Africa. And 214 million women of reproductive age in developing countries who want to avoid pregnancy are not using modern contraceptive methods according to World Health Organization. So why is this the case? Well, you want to stick around till the end of the show and find out why. And of course, if you are a woman of reproductive age and wondering what contraceptive to use, because there's so many myths surrounding contraceptives, and most importantly, most women tend to actually use what their friends used, thinking that it will work for them, but most of them find that it has some sort of like side effects to them. So today we'll talk about contraceptives and what you need to consider before choosing a certain contraceptive that will work for you. So again, you want to stick around till the end of the show, but if you have any question, feel free to send us a text message on 40920, and of course we'll be answering your questions as soon as we get them. But before you meet our guest for the day and before we get on with the discussion, take a look at this video. We'll be right back with more. All right, welcome back. And just in case you're tuning in right now, you've not missed a lot. We're just getting started. And the show today will focus on contraceptives. And like we said, there's so many options out there. And sometimes it can be confusing for so many women to choose what works for them. And most of us tend to actually use what our friends used. And is it safe? Is it dangerous? Well, stick around till the end of the show and find out more about this. But again, if you have any question in relation to the same, remember to send us a text message on 40920. And we'll be answering your questions as soon as we get them. And my guest is here, ready to answer all your questions. So good morning, Dr. Njenga.
Good morning.
Thank you so much for always making time for us. We really, really appreciate your time.
Thank you so
before we
much.
get into the discussion, kindly just say hi to the lovely audience.
Good morning, viewers. My name is Dr. Njenga. I'm a general practitioner in private practice. Welcome to the show.
All right. Now, like we said, you see, there's so many types of contraception or contraceptives rather,
Yes.
in the market. Some, I don't know whether they're fake, and others, well, they're genuine. But now, when it comes to then choosing the right mode of contraceptives for a person, again, it can be confusing. So, are there like factors that, let's say, people should consider before choosing a particular type of contraceptive to use?
Okay, thank you so much, Winnie. I wouldn't really say there are factors to consider before choosing a mode of contraceptive to use. But I would say that it is very important for women that want to seek methods of contraception to actually visit their health care providers, the physicians, the gynecologists, the nurses, whichever cadre of a health practitioner, so that they can get advice depending on the maybe probably how long duration. Is it permanent? Do you want permanent method of contraception? Do you want a long term? Do you want a short term? Yeah, you should. Those are some of the factors I think that we should consider. But the first thing is to go to visit a healthcare practitioner. You make a discussion with them, and then you make an agreement. You come to a consensus.
Okay.
Yes.
Now here's the thing: most women would say, "Okay, fine. I know I want it short term."
Yes.
All right. So why then go to a healthcare provider? Because I know I want it for a certain period of time, let's say 3 months, 6 months, a year, or something like that. And then, of course, later on, I would get off contraceptive and then try to get a child. So why go see a healthcare provider? Why is this very, very important? Because most women don't.
It is very important, Winnie, because apart from a woman saying that I know it, I want it for a short time, there are various contraceptives that we have. And when you go to a healthcare practitioner or provider, they will enumerate them to you. They will tell you the advantages of this, disadvantages of it. They'll take another one, tell you the advantages of it and the disadvantages of it. So when you make your own decision, you might find that you will make a wrong decision. For instance, there are contraceptives that women use when they give birth. a specific type of contraceptive. So if you just decide, let me just go and pick a contraceptive, do you see you'll mess yourself? You will basically and definitely mess yourself. So it is always important. Issues health, all issues health, it is always important to seek medical advice or healthcare professional advice.
Okay.
Yes.
Yeah, we're trying to discourage that aspect of self-medication.
Self-medication.
Yeah, anything
is
to
bad.
do with the same.
Yes.
Okay, Dr. Now, right now we're seeing an increase, and especially between the ages of around 15 to around 24 there, so many young girls, of course, most of them actually start engaging in sexual behaviors at a very early age, and most of them will not even go to a hospital and try to seek, one, advice, and two, to understand the best sort of like type of contraceptive to use, because condoms clearly don't work. Most of them don't use it.
Exactly.
And we're seeing, of course, early cases of, cases of early pregnancy. So most of them will just go to a pharmacy, get whatever they get, and then that's it. And most of them tend to abuse. So for such a group, I know this is a discussion, like a very sort of sensitive discussion, of course, to have with the parents, because parents don't want to sort of build that or sow that seed to their young ones that you know what, you can just go to a healthcare provider and choose the right method of contraceptive, because they think that is one way of promoting promiscuity among the young people. So what now, especially for this group?
Basically, let me say, Winnie, we are talking about that age group because maybe our moral standards have gone down, or secondly is because there are changes in the society. It's not like when our mothers were being brought up, they would not engage into sexual activity until maybe when they get married. But you see, the situation as it were right now is different. Young girls as young as even 12 years, those in primary school, you find they have started engaging in sexual activities. So much as we talk about the modes of, the importance for them to know the modes of contraception, just as you've said, parents and the people in the society will actually think that this is a way of encouraging them to engage into sexual activities. So I think the most important thing for parents first is to tell them that you don't engage into sex before getting married. But it's also important to know that this thing is with us today. So these are the girls, some are in college, some are in secondary schools. They should be told that there are safe ways of preventing pregnancies, because you find they abuse, especially the emergency pills, the morning after pill, as they call it. They really abuse it. They go engage in unprotected sex, and then they just say, I'll just take.
I'll get the morning.
In fact, there's a word they say, I'll just use a P2. There's a very common drug, emergency contraceptive in this country called P2. So that somebody will tell you, I'll just go buy P2. So you see, and in doing so, they abuse, because actually, as the name suggests, this emergency contraceptive was initially designed, or it was initially made to prevent pregnancy in cases of emergencies. But you see, this one is not an emergency.
It's not. And will it have sort of like an effect later on? And especially when, of course, they're ready, or they feel they're ready to have children. That abuse at that particular age, will it have an effect on them later on?
I would say basically it can, because one of the things that can happen with overuse or misuse of hormonal contraceptive, because this is hormonal, is that you can create some hormonal imbalance in your body. And you see, these are synthetic hormones or man-made hormones that we introduce into your body to prevent
Pregnancy, yeah.
And they are at a very high dose. That is why they actually, that's why it's an emergency.
Yeah.
It is not the normal
Meant to-
contraceptive.
yeah.
So you see, it is at a high level or dose. So when these girls abuse, most probably, what if they get hormonal imbalance? This hormonal imbalance leads to other things like polycystic ovarian
cysts.
syndromes or cysts, whatever. Do you see this person will have difficulties when it comes to conception when they get to that age now, when they get married, they want to get kids, they will have a lot of problems.
Yeah.
Yes. Not to mention that even lately you've heard that there is a notion, is it a notion or an idea that cervical cancer is also related, is one of the factors or the risk factors is those people who have really used contraceptive for over a long period of time.
Yeah.
Yes.
All right. So, yeah, it wasn't meant for, I like what you said, it wasn't meant for everyday
Yes,
use.
it wasn't.
It's cases of emergency.
Emergencies.
Okay. All right. So can we then talk about, go through the various types of contraceptives very quickly before we talk about their effectiveness and how do you know this one will work for me and this one will not work for me?
Exactly.
Yeah.
So thank you so much. Definitely we have various methods of contraceptives. I don't know how I group them.
Okay.
But I think I will be able to group them so that the audience may be able to know.
To understand, yeah.
To understand, actually. So I will like to group them as we have hormonal, number one. Hormonal contraceptives are in forms of pills and injection. Others are also in form of patches. So as we talk about hormonal contraceptive as the first group, under hormonal contraceptives, we can say the pills, we can say the injections, we can say the patches, and also in that group we can say the pills. We have two types of pills, two groups of pills. We have what we call progesterone only. That is a hormone in the body of a woman, a progesterone. So we have a hormone, a contraceptive that is progesterone only. And then we have a pill that is combined. This pill has combination of estrogen and progestin hormone. Those two hormones, now they become combined. So you use it as a way of contraceptive.
Okay.
And then we have injection. Then we said injection as the types in under hormonal. Injections is just an injection, but it's always progesterone only.
Okay.
Only. So we have number one is hormonal. Number two, we can have non-hormonal contraceptives. And I don't know whether now I say under this non-hormonal contraceptives now, we have long-term reversible contraceptives.
Okay.
Long-term reversible contraceptive. Number one long-term reversible contraceptive is that is non-hormonal, is called intrauterine device. And this intrauterine device, the one that is mostly and commonly used in this country is called copper IUD, copper intrauterine device. And then under it also, the long-term reversible contraceptive, we have implants. But now you find implant is also now hormonal.
Yes.
Implant, it is an implant, but it's hormonal.
It's hormonal, but it finds its way as well into the
and I know people know
reversible.
implant because it's a rod-shaped. What do I call it now? It's a rod-shaped thing that is inserted just below the skin in your upper arm. So you see now that is a long term. Why long term? Because you'll use it for a very long time. You even forget you're using a contraceptive. We also have another group, barrier methods. Barrier method of contraception. Here is where we talk about condoms, male and female condoms. I don't know whether still we have what we call diaphragms and cups, cervical cups. Those are barriers because the barriers are essentially meant to prevent entry of the sperm into the woman reproductive system. So we have barrier, and then we have permanent contraceptives. This one, there are two, for women and for men. For women, we have what we call tubal ligation. This is whereby a woman is put under general anesthesia, and then a gynecologist or a doctor goes in and either ties or cuts the tubes, the fallopian tubes. And then we have in men vasectomy. Vasectomy now is where also it is a procedure, a surgical procedure, where the doctor or the gynecologist also goes in and cuts the tube called the vas deferens. This is the tube that carries or transports sperm or spermatozoa from the testis to where we call the seminal vesicles, where it gets the semen and then goes through the urethra. So it is cut off so that there is no now inflow of sperms. So that is called permanent or what we call sterilization, either male or female sterilization. Those are how many methods? I don't know how many I've said. But there's also another one we call fertility awareness. I don't know whether long time ago, even today, there are some people who, even some people in some specific religions use this fertility awareness. That is where, Winnie, you will understand your cycle.
And this is more on the woman.
Yeah, on the woman now. She understands her cycle. And now she is able to learn the days when she is most probably fertile. The days she's ovulating. And then when she's able to know those dates by calculation, of course, she will be able to prevent pregnancy. Though it is a very risky method. Very, very risky. And then we have another method we call, we have lactation, amenorrhea mode of contraception. This one, I think, is what our grandparents used to do. Because I don't think there was contraception those days. When a woman gives birth, immediately she starts breastfeeding. And if it's exclusive breastfeeding, where you're breastfeeding mchana na usiku, sio kama hii siku hizi where women they just want to go back to work. I don't know whether it's because of the economic status we are living in, I don't understand, but a long time ago, a woman would breastfeed exclusively for 6 months. So during that time, she will not have her menses. Her periods will not have returned. So she uses that as a way of contraception. Because there is a release of a hormone in the breast called prolactin that now inhibits the release of the hormone that are responsible for ovulation and so on. So this is also another method. So we have outlined those methods.
Pretty interesting. Now, so just going back, and I think I will start with understanding your cycle. Especially for women. You talked about the fact that it's risky, because I've had so many women say, I did that. I tracked my cycle for a very long time, but it just happened. I got pregnant. And especially for those, and major concern should be, of course, for people who have irregular menses. So,
or cycles.
So is this a method probably they should try?
Actually, this method should be tried by people who, number one, have regular cycles or regular menses, not irregular, and not people with hormonal imbalances. These are the people that understand their cycle. They know that I will start calculating on the first day of my menses. I will count how many days, I don't know, 14. From there, I know on the 14th day is probably my ovulation day. So I'll go 3 days, maybe 2-3 days before my ovulation days and 3 days after, and mark those areas and say these are dangerous days in my cycle. So it should be used by those people who truly understands their body. And then there should be consensus. Like, for the couples. It should not be just done by a woman.
Yeah.
It's a couple should sit down and say, now we are calculating our days. This week, this is a dangerous week. If we engage in sexual activity, I'm going to conceive.
Yeah.
Yes.
Okay.
And probably also it is also worth noting there are people with high fertility rates in this land. Even there are regions you
Like
hear
the
the fertility rate is very
it's
high.
very high.
Yes,
Yeah.
compared to other regions.
Yeah.
So, and also I think those are many factors that could contribute to fertility rate, including diet and all that. Yes.
Okay. All right. And yeah, because of course the biggest question is, does it really work? But like you said, understand your body,
It
understand your
works.
cycle.
It works.
It does.
There are people you'll get in this country, they tell you, me, I've never used
Never tried contraceptive.
contraception.
Yeah.
And they have 2, 3 kids.
Yeah.
How do they manage that?
Okay.
Of course.
All right. Understand your body and your cycle very well. But
Yes.
just sometimes the weather, like there's so many things that happen. The weather changes.
Yes.
What
Traveling.
else? Traveling, exactly.
Yes.
And all those things. So,
Using
be
drugs,
aware
maybe
of
you're
that.
sick.
Yeah.
Yeah. Those are factors that could affect.
Yeah.
So it is usually important, maybe when you're not sure, you use a backup method,
Okay,
like
all right.
barrier methods.
Okay.
Yeah.
All right. Okay then. And then we talked about, especially for the hormonal, that aspect of others are made of only progesterone only,
Yes.
and others are combined. So comparing these two, is one more effective than the other, or it depends?
Now, it depends with the person.
All
I
right.
would say it would depend. All of them are effective if used correctly.
Okay.
Either the combined oral contraceptive or the progesterone only oral contraceptive. They are all effective. And also, I would say there are people who do well with progesterone only.
Okay.
They don't have side effects.
Okay.
And there are people who do well with combined oral
yeah.
contraceptives. I have, in my practice, I have noticed most of the time, people who have conditions like hypertension basically do not respond well to progesterone
only. Okay.
So sometimes combination is good, or now you explore another method. Because you find when you give them this, their pressure goes up. Some people would use an oral contraceptive, the progesterone only, or the combined, and you find they have started developing side effects, nausea, vomiting, diarrhea, you know. So it depends with the person, but they are usually effective if used well.
Okay.
If used well, adherence to compliance is very important.
Okay.
Yes.
And there's some women who have, like, of course, underlying conditions, like for instance, hyperthyroidism.
Yes.
Are they supposed to use hormonal or non-hormonal types of contraceptives?
If you ask me, I'll tell them to use non-hormonal.
Non-hormonal.
Yeah, because,
okay.
you know, a thyroid, issues with hyperthyroidism, like we discussed last time here, would lead to increase in blood pressure. And then you find now you're adding another hormone in your system. You see, it can also make the hypertension and the thyroid condition unmanageable. Yes.
Okay.
And you see they still need to
Yes.
plan for their family.
Yeah.
Yes.
So use non-hormonal.
Yes.
Okay. But what if they sort of react to the non-hormonal type of contraceptive? What now? Go to monitor your cycle, or what happens then?
Now, this is a tricky part.
Yeah.
Because you find there are women in this country who do not actually do not do well with hormonal contraceptives. You put them on non-hormonal, they don't do well. So that is where you now sit down with the patient and explore methods like, how many kids do you want? Do you have?
Yeah.
How many? Yes. Okay. How many do you want? Do you think you can get the kids you want, and then we do the permanent method? Because maybe even you tell her now, start using the fertility awareness method. She tells you, no, that one, you know, my friend, that one I won't even try.
I won't. And it's true, and especially for the men.
Yes.
Vasectomy is like a do not even discuss, do not even bring that up, do not even think about it. Yeah. So we need to take a very short break. But of course, when we come back, there are also some contraceptives for the men, and
Yes.
we've heard about the patch and the gel and all that. I
Yes.
think we can also discuss about
Exactly.
that. So if you have any question in relation to the topic of discussion today, very, very insightful discussion we're having, then feel free to send us a text message on 40920, and we'll be answering your questions as soon as we get them. See you after this very short break. All right, welcome back. Glad you're still with us. This is My Doctor, and just in case you're tuning in, today our focus is on contraceptives. And of course, before we went for break, we were discussing about the different types of contraceptives that are out there. And of course, some of them, of course, based on whether they are hormonal or non-hormonal. Of course, now we want to tackle about something that most men are not comfortable about, and that is on the male contraceptives. And of course, the ones, are they still under research?
They are.
Yeah,
They are.
the gel
Yeah.
and the patch. That is
Yeah.
like gel and the patch. Yeah, those are the ones that we know. Can you just tell us briefly about them?
Actually, when that is something that is under research, because their aim is to basically stop or to actually block the production of the spermatozoa from the testes. And that is why maybe it has taken a long time.
Yeah, because over time those, like, they conducted, what is it called? The studies were conducted in Kenya, and they were calling for men to go and be a part of the research.
And nobody, I think, went out. Yeah, because you realize every second, about 1,500 sperms are produced.
Yes.
So you see it is actually difficult to stop. So whatever that is going to come out as a male contraceptive pill or a patch or a gel has to have the capacity to stop that production.
Yeah.
And I don't know how long it is going to take, and I'm not even sure whether the men are going to accept that.
Yeah.
I'm not sure.
No, we had a discussion sometime here in the office about the,
Yes.
and of course we asked the men whether they would want, and most of them were like, do not even go there, don't even mention it, because we will not.
Yes.
Because most of them think or said that this is like a woman's responsibility. But don't you think that puts a lot of pressure
On women.
Yeah.
I think it's a myth.
Yeah.
Or the way we were brought up. We were brought out knowing that women are the ones to take the contraceptive, not men.
Not men, yeah.
That is why even whatever we have as a method of contraceptive, vasectomy, I don't know how many men have done that.
God, yeah.
Very few. Actually, I only know of one who has done vasectomy. So basically, it is an idea which is very hard to sell to men.
Yeah.
It is basically hard until, I don't know, we become, how liberal, I don't know. Yes.
But we should try and get there. Anyways, so, and especially, you talked about vasectomy, which again, not so many people, of course, opt for that. And even for the women, the tubal ligation, of course, most of them, I don't know if sometimes we think that we've had enough children and we are done. We do not want to have any more children, and we do not want to go through, that process of contraceptives, either taking the pills or implant or IUD or whatever it is. And then later on, let's say someone feels they want children, and you see, this is irreversible, like we said earlier.
It is.
Yeah. So what then should happen? I mean, should women go through sort of like counseling or something like that to just make sure that they're sure about the decision they're about to take?
When it comes to permanent method of contraceptives, I think a lot of education should be done and sensitization, such that when a woman decides to do permanent contraceptives, she should be taken through, as you've said, counseling and told, okay, this is a permanent method. Once you do it, you cannot reverse.
Yeah.
And then you're told about the consequences. And the consequence is it's irreversible.
Yeah.
So that if you have 2 kids today, and you are 30 years old, and then you get to 40, you want to have kids.
Yeah.
And now you had done the permanent method of tubal ligation or vasectomy. You see now it will hit you very hard when you comes to that time,
Yeah.
knowing that you cannot conceive again, I can basically tell you, when I was in secondary school, in our neighborhood, there was a woman who had only one child, and she did tubal ligation.
Yeah.
And unfortunately, they got involved in an accident, and the child passed away. Now, this woman, I think when she went back to her gynecologist, the gynecologist told her, you know, what we did is irreversible.
Yes.
She got so stressed up until she committed suicide. So you can imagine, those are things that people should be told in advance, that listen, you want permanent method? These are the consequences.
Yeah.
Because I think they could hit you hard.
Yes.
So people should be made aware. Every contraception you choose, let you be told the advantages and the disadvantages.
Yeah.
So that you can make a decision
Yes.
alone.
Okay.
But also, I don't know whether it's funny enough, there are women who don't want kids, so they prefer to do
Yeah.
tubal
Tubal
ligation.
ligation. Yeah. Okay. Now, and we also talked about the other types of contraceptives where they
Yes.
block.
Yes.
Of course, the sperms from getting into, you know,
The system of the
the
woman,
system.
the reproductive system.
Yeah. So for them, how then do they work in terms of how long should they stay there, you know, and things like that? Should you remove them at some point when, let's say, you want to, should you remove them at some point? Or let's say you don't want to have kids for like 3 months, and especially this is for the newlyweds, because we have so many myths about, if you're just married and you do not want to have kids, you can go for, you know, the whatever form of contraception.
Yeah.
But other people say that if you start that contraception, then you will not have kids, or if you do, they'll be, you know, they'll have problems. So let's say someone wants to go this other way, and that is on the blockage. So for how long should they be on that type of contraceptive?
Like the barrier methods? Actually, barrier methods, when you use barrier methods, and we said here they are either male condoms, female condoms.
Yeah.
We have cups, cervical cups, and we have also diaphragms. When you want to use those contraceptives, for condoms, we know you use them daily, as in when need arises. Cups and diaphragm are inserted into deep into high deep in the vagina, close to the cervix, to prevent entry of sperm. So when you want to conceive, basically you just remove them.
All right, but you have to go to a hospital to remove them.
Yeah, exactly.
Okay, all right.
It is usually important. There are people who would say, I'll just
remove it at home.
Yeah, you know, people have different characters. And what they believe in. Some say, I can do this. So, but it is important to actually note there are contraceptives which even when you stop, you just conceive immediately.
Immediately, yes.
Even pills. That is why you're told if you're taking oral contraceptive pills, take them daily. Missing even a day can make you get pregnant. Yeah, because it protects you for some few hours, for a period of hours, a day. So that's why you're taking a day, every day, okay? So when for the newlyweds or those couples who are newlyweds, I would ask, it is always important to use short-term contraceptive methods. That's what, once removed, your fertility rate is maintained. Because you find like the Depo-Provera, the injection, in practice, you know, some of these things you get them in practice. You find that somebody tells you, I was given Depo-Provera, I've used it for a year, I have stayed for 3 years, I haven't gotten my menses, I haven't conceived. What is wrong? You see? So those are the factors that you should consider as a health care practitioner and even as a person seeking the method of contraceptive. Get to know, get the knowledge that is required. How long do you want to use this contraceptive?
Okay.
Yeah.
All right. And you see, I was actually about to ask you then after, and especially when one is off, contraceptive, there's some who conceive immediately, others take time. Why is that the case? But before we talk about that a little bit, at least like more in depth, could you talk about then instances where someone is on contraceptive,
Yes.
whether hormonal or non-hormonal, and then it doesn't work? And
They
let's say,
die.
yeah, and then they don't want to conceive, let's say, for a particular period of time, and then they just conceive.
Yeah,
And we've had some women who say, even those who are using the implants, let's say they put one for like 3 years or 5 years, but they conceive even before they remove it. So what are some of the cases that might lead to, this, of course, not being able to, or not being effective enough?
Okay, let me say everything that we use sometimes have failure rates.
Yeah.
For instance, let's start with the intrauterine device. When it is inserted, it looks like a T, such that it is inserted into the uterus through the cervix, and the T's goes into the fallopian tubes.
Yes.
Basically, what this copper T does, it is one of the instruments that kills the sperm, the copper, the coating of the copper. It is a spermicidal. It kills the sperms. So, for instance, if that copper T is not in position, see, the sperm will pass through.
Yes.
And you just need one spermatozoa to fertilize one egg.
One egg, yes.
So there you go. You will get pregnant. Number two, if you are using a barrier method, like a condom, it bursts.
Yes.
And those are many instances we've come across. Just spermatozoa will just slip in. There you go. You conceive. If you are using pills, and you're not using them appropriately. We said use them appropriately. There are women I have known who maybe, for instance, their husbands don't live with them. They work elsewhere.
Yeah.
So some of them tell me, I just use my pills when the husband is there. I tell them, no, you're supposed to use the pills every day because this is not an emergency pill. This is a normal contraceptive pill. So use it daily. So you see that breakage in cycle can make you conceive.
Yeah.
And then it is usually good for people who are taking contraceptives to actually, if it is oral contraceptive, let them check on the expiry date.
Yeah.
What if you're taking an expired contraceptive?
Yeah.
Even the injection, just tell your healthcare practitioner, what is the expiry? Even the implants.
Yeah.
Even the IUCD, everything has an expiry. Just check, be sure you got it right. Don't just assume, because even the healthcare practitioner can just say, let me just give, and they haven't checked the expiry. So those are factors that could contribute to a woman conceiving when they are taking the contraceptive. Others would get sick, like those people who are on oral contraceptives, they get sick. Maybe they are vomiting, they are diarrheaing, and then you've taken the contraceptive, it hasn't worked.
It hasn't worked, yeah.
There you go. You'll definitely get pregnant.
Get pregnant.
Yes.
Okay, so look into all those factors.
Yes.
Okay, and then again, that aspect of, after, let's say you are off contraception, then how long should you wait before trying? Because again, there's some people who said, well, I want to get a baby immediately as soon as I am off contraceptives, and then that doesn't happen. And some people will say, maybe it will take like a month or two, and then they conceive immediately. So how long should one wait?
Okay, Winnie, conception involves a lot of factors. That is what people don't understand. If I say you will only conceive one day in a month, you'll be shocked and surprised. But it's actually a day in a month.
Okay.
So if you don't get right the day, how will you even conceive in the first place?
Okay.
Because
do we know?
Because that's why we talk about understanding your cycle. Knowing your cycle. It's imperative of every woman to know their cycle. You just don't conceive any day.
Yeah.
Those are things you should visit your healthcare practitioner or your gynecologist.
Okay.
Let them teach you that this is your cycle. 28-day cycle, 21-day cycle, 35-day cycle. The day that you are capable of conceiving is this day. Okay? And then, number 2, for instance, if you're using a contraceptive Depo-Provera, progesterone, that is injected, it depends on a person. How long does it take for your body to clear the effects of the hormone from the system?
Okay.
That is why we said for oral contraceptives, most of the people who have their fertility right, their fertility rate is okay, immediately they stop. They don't even go far. You just find the other month,
almost immediately,
somebody has conceived. Somebody on IUCD, removed, they conceive. Somebody on implant, removed, conceived. It also depends. There are so many factors that come about to play in this issue of conception after stopping the contraceptive. There are so many factors. Even condition. You could have a condition like diabetes, which has not maybe been diagnosed, or you have it diagnosed. You know, you cannot just conceive like immediately. There are many factors that come into play. Yeah, so even conditions should be evaluated. Yeah, some people have hormonal imbalances. Some people have you could have the cysts. Maybe you've been using contraceptive, now you've developed the cyst, ovarian cyst. Some people have what we call a low anti-Mullerian hormone. That is the hormone that is responsible for the production of a fertile egg.
Okay, so should that be done then before or after? Like before one gets on a particular contraception, when you go, of course, for consultation with your practitioner, should that be put in consideration before or after one is off contraception?
I think when you visit your healthcare practitioner, when you want to start the contraceptives, that's why I said you explore. Do you have kids in the first place? How long do you want to nanny? Do you have anything, any medical condition? Do you have problem with your cycle? So that if I notice you have problems with your cycle, let me first establish what is wrong. Do you have fibroids? Do you have ovarian cyst and ovarian growths or something? Are your hormones okay? Or you have hormonal imbalance? That's why history is important. Don't just go take contraceptive because Winnie is just taking this. I also want to take this.
And it worked for her.
Yes.
Okay. All right. And then, aspects of side effects. Again, and of course, like we said, one of the factors that contribute to side effects is that aspect of one uses a contraceptive that, let's say, the other person used and it worked for them. So, of course, you expect it to work for you, but it doesn't. But then again, which ones are more prone to having side effects? Is it the hormonal or non-hormonal? And if so, what are some of the side effects that are experienced?
All of them have side effects, but hormonal have more side effects compared to the non-hormonal. Yes, because actually, for instance, when you take an injection, hormonal progesterone, or progesterone hormone that is injected into your body, I will talk about it as experience. You find some women, you give them the injection, will not have their periods. That is one of the side effects. Every woman wants to have their periods. I have never seen, unless one I saw that told me I wish I don't have periods in my life. But a woman would want to have her periods. So you can get what we call amenorrhea, that is lack of period. So that is one of the side effects. Some people get spotting, that you just spotting all the time. That is a side effect. Some women will have excessive bleeding. That is a side effect. Some other women would have nausea and vomiting. This is more on oral contraceptives. Others would have headaches, severe headaches. and others will also have back pains, backaches. Especially with Depo-Provera, I have seen it. A woman will come tell you, I have a very severe backache.
Backaches. Yeah. Why is that? Because they prefer
I don't know.
backaches.
I don't know the relationship.
between-
yeah.
yeah.
But some of them will come and tell you, I've been experiencing headaches. Some of them will gain weight, a lot of
A
weight.
big problem.
Yeah. Some of them will lose weight, and you
Yeah.
think they are very sick. They become like, I don't know, like this.
Yeah.
I don't know what that is called. And also, it is, I was talking about the side effects of Depo or hormonal contraceptives.
Yeah.
So many of them will add weight, others will lose weight. And one important aspect that I wanted to talk about, and I think I forgot about that side effect is gone, but it's going to come back. Let's go to non-hormonal, like the IUCDs. You find one of the side effects that you get is recurrent infections.
Infections.
Yeah.
Yeah.
Recurrent infections, because this is a foreign thing, number one. I don't know how it's going to respond with your body. There are people who don't who don't actually do well with foreign objects in their bodies. They will get recurrent infections. Another side effect is, we said, you can conceive while you're still having the contraceptive.
Yes, the contraceptive.
I also wanted to say about hormonal. I have found women coming to us and telling us the libido has gone down.
Yes.
It has gone down, and especially with the Depo-Provera. They tell you the libido goes down totally, completely. So
Yeah.
sometimes we advise them to use the non-hormonal contraceptives.
Okay.
Nevertheless, I think I've outlined those side effects: nausea, vomiting, headaches.
Headaches. Yeah.
Yeah.
Okay.
Increase in high blood pressure, in your blood pressure.
Okay.
So you find that you're using a Depo-Provera or an oral contraceptive, and your pressure has gone up. Yes. And then we said even those with oral contraceptives, some of them get recurrent infections.
Yeah.
They get
Okay.
recurrent infections.
Okay.
So
So
those are
baseline,
the
just go to a healthcare provider and understand which one works for
yeah,
you. So
which
that
one
we
works for
avoid-
you. And
yeah.
the ones that works for you might not work
For someone
for
else.
someone else.
Yes. All right.
Yes.
So as we finish, because we have like 2 minutes to go.
Yeah.
So then, in terms of then contraceptives, do they only prevent cases of pregnancy, or do they also help in other ways? For instance, cases of STIs, and of course we're talking about condoms. But other than that, cases of abortion, cases of early pregnancies, and all that. So can we just talk about them very briefly, and then your parting shot as far as contraceptives?
Thank you so much. Contraceptives protect and prevent early pregnancies. That is very true, because when you use contraceptive right and properly, you will prevent early pregnancies, which most of the times has led to abortions in this country,
Yeah.
and even morbidity and mortality, because people go to backstreet, they do abortions, and then they backfire, and then they end up either
Yeah,
being
like
admitted, they lose a lot of blood, some bleed up to death.
Yeah.
Contraception helps in family planning. For those who are married, you see, now you say you talk with your husband, with your wife, we want to have 3 kids, and we want to use this method of contraceptive. Contraceptives, except for the barrier methods like condoms, we are talking about condoms here. Only condoms protects and prevents you from contacting STIs, but the rest. By doing contraception, we are not protecting you from STIs, which include gonorrhea, syphilis, HIV, AIDS, hepatitis B, very many conditions, STIs that we have. We are not protecting you from those. So it is very important for the viewers to know that by using a contraceptive, apart from the barrier method, the condoms, we don't protect you. They don't prevent and protect you from the STIs.
Yeah. And it's funny because condom, of course, it's not only does not only prevent pregnancy, but also cases of STI.
Yes.
But it's funny because it's the least used.
It is the least used by
type
people.
of contraceptive.
It is.
But Dr. Njenga, thank you so much for always coming through for us.
Thank you.
My doctor, we really, really, really appreciate.
Yes.
Of course, thank you so much for just giving us all the info about contraceptive. Very, very important for us to understand. And I think the most important thing or the takeaway message from today's show is always involve your healthcare provider so that you know which one works for you. All right. So thank you so much for staying with us as well until the end of the show. Now I believe we have a better understanding as far as contraceptives is concerned. We have to end it here. My name is Winnie Lubembe. On behalf of everybody else who put together this show, we wish you a lovely day ahead. We'll see you next time on another episode of My Doctor. But for now, it's a goodbye from us. Stay safe and God bless. Goodbye for now.